This is the story about Naomi Gomes. This is a remarkable story of treachery, greed, and malice. She's the first bad actor in this story. Before she came to see me as a patient, I'd met her many years previously. Her son Daniel used to play with our kids. One day, while I was still consulting at my rooms at the Glenwood Hospital, Gomes came to see me looking for employment. I found her to be personable, and I would have employed her had there been a position available as a receptionist. The next bad actor in this story is a guy by the name of Gary Austin. Austin is a self-proclaimed multi-millionaire, having made a fortune off suing doctors and hospitals. And by all accounts, he has retired and has a henchman working for him now. The next bad actor in this story is a guy by the name of Leslie Berkowitz. He's a retired plastic surgeon who worked for the last few years of his practice at the Santon Surgical Day Clinic because he was hoofed out of the Morningside Clinic due to his odious people skills, but more on that later. Before carrying on with the story, I want to let you know that I recently released the first volume of my serialized memoir. It's a short book covering only the first part of my life and my journey to becoming a doctor and ultimately a plastic surgeon. In the coming books, I will relate how a pair of psychopaths organized sham hearings at the Health Professions Council of South Africa, and I will deal with each of the complainants in a subsequent volume. The book is available on Amazon in Kindle format as well as an audiobook. The links are in the description below. I next saw Gomes on the 1st of November 2009, where she came to me requesting a breast reduction. She supposedly was suffering from pain in her breasts and discomfort, and I say supposed because there are many question marks over the authenticity of her symptoms. She wanted a breast reduction to remove most of the supposedly painful breast tissue in her breasts. I was starting to record consultations at this stage because it seemed as if many patients were running to the corrupt Health Professions Council to complain and would allege that I had never informed them of the risks and complications, which is a complete falsity. I recorded the consultation with Gomes, and unfortunately the original recording was lost, but the transcript survived. And I'm going to share with you a reenactment of the conversation that took place between Naomi Gomes and I on the 1st of December 2009. I'll make comments as the consultation goes along.
Naomi, not met before, hey?
Yes, we have. I know your wife Annette. Jared, yeah?
This was my first interaction with Naomi Gomes when she came into my rooms. She had been led into the rooms with her file, and there was something about her that I thought I recognized, but I wasn't quite sure. And she immediately mentioned the connection between Annette and her. We actually stayed in very nearby her in the suburb of Northmead in Benoni.
Okay, of course, yeah. How are things going?
Very well.
Is it?
Very, very well. And you, yeah?
Yeah. It's been a bit quiet on the work front, but picking up now with summer coming, and I think the recession is starting to improve. Hey, yeah. How are you keeping? Are you still staying up there?
So these were the opening pleasantries where we were reconnecting and establishing where each other lived, and really just formalities in the initial discussion. And I was about to ask her whether she was still staying in Northmead, where she stayed around the corner from where Annette and I stayed, and Daniel used to play with Annette's sons. I think they were actually at school together.
No. I got divorced and involved with an incredible man. We live just around the corner and are about to move. And now, before we do move, I think now I've got to have the surgery done.
What did you have in mind then?
I've got fibrosis of the breasts. In the last 5 years, 2 cup sizes. I'm struggling to find bras.
This is actually a matter of debate, because I find it quite difficult to believe that she'd gone 2 cup sizes bigger. And as you'll see, she grossly exaggerated the size of her breasts, trying to create the impression that they were very much larger than they were in real life.
But I can't. It's very uncomfortable. I don't feel feminine.
Yeah, okay. So you're wanting to debulk the breasts, but still have a nice volume afterwards.
Yeah, I was just reflecting to make sure that I understood what she wanted, and it would appear that her symptoms were that of pain. But again, I'm very much in doubt whether they were actually real symptoms. As the story unfolds, you'll be able to gauge the veracity and truthfulness of her symptoms.
Or do you just want to go smaller?
I wanted to basically remove everything so I don't get fibrosis again, and I've got other cysts as well.
Okay, we'll chat more about that in a second, but I think let's have a look at your breasts and do some measurements and all the rest of it.
So at this point, I wanted to examine the breast, and certainly the strategy is not unreasonable if a woman experiences an undue amount of pain from her breast due to fibrocystic disease. It's not an unreasonable strategy to do a radical breast reduction, but we carried the conversation on after she had gone behind the screen for examination.
And then we can chat a bit more about that. Just take off your top and your bra, and then take a seat. You can put a gown on and then take a seat.
Must I put the gown on?
It's difficult to understand what part of take off your top and bra and put the gown on, but nevertheless I opted to be courteous in this situation.
You don't have to if you don't want to. Just take your top and your bra off.
So how's Annette doing?
At this stage she was making small talk while she was getting ready to be examined, and I answered in nondescript small talk responses.
No good, hey? She's also working on a couple of little projects, but yeah, no. Otherwise, well, man. Now, your son... Daniel, how's he doing?
The story that's about, or the information that's about to be imparted here, I believe is way more significant than it appears on face value. She's going to disclose about how her son was attacked by a dog and sustained apparently serious injuries, and was featured in the local rag, Benoni City Times. And my theory is that this is how she first made contact with a guy by the name of Gary Austin, who probably did a personal liability claim on Daniel's behalf, but then the story developed further after that, and you'll see how it develops as the story unfolds.
Oh, he's recovering well after the attack.
What happened to him?
He was attacked here in Lakeville by a dog, quite badly scarred as well.
Yeah, so he's badly scarred as well. That was in the paper, hey?
Yeah, just lucky he didn't die.
And your ex-husband, that was,
Joe Gomes.
Joe. That's right. Now it all comes back to me. Okay.
Luckily he's not here.
Not quite sure what the meaning of that statement was. Rather strange remark to make, but let's carry on.
Okay.
I want to have everything removed and then put in a B cup.
Okay.
Because I've got back problems as well, and my spine is starting to take strain under the extra weight.
Okay.
So they told me 2 years ago, already I'll need to have surgery to have it removed.
Okay.
To get to the psychological,
Also not quite sure what he's referring to here in terms of psychological aspects, but having a look at her breasts, and as you will see later in the video, she certainly didn't have massive breasts, and I find it difficult to believe that she was battling to find bras, but it all fits in with the bigger story.
Is it painful as well?
I wake up every day with back and neck pain. I go to a chiropractor quite often to have the problem sorted. He told me that my spine is starting to take strain.
This is very doubtful, in fact. Large breasts, well, you need breasts genuinely in the region of double D to E, and just in the light of the greater story, I think this was, she was just making the right noises.
Now I've got two choices. Either I have to have work done on my back, or I've got to have my breasts removed.
Okay. No, it makes sense too, to reduce the size of the breasts and the volume. Okay. And otherwise, you had a laparoscopy.
At this stage, as a matter of course, would refer to the front cover of the file to establish any relevant medical or surgical history, and that's all she'd written down on her front cover of the file, which was for endometriosis.
Yeah, I had endometriosis, but I haven't had surgery for that in years.
Yeah, is it? Okay. And smoking? How much do you smoke?
This was a rather interesting question, and there was very much a mountain made out of a molehill here. As you follow the story, she was a light smoker, 5 to 10 a day, although most people who smoke underreport the amount of what they smoke, and most people don't stop smoking prior to surgery. But it's imperative to warn a patient of the potential hazards, and certainly a heavy smoker would be advised to postpone surgery until they had stopped smoking. But let's follow the conversation further.
Between 5 and 10 cigarettes a day. I'm not a chain smoker.
Yeah. Do you think you could give up for a couple of weeks before the procedure?
I can try.
26, 27.
By this stage, she was seated in the chair behind the screen because the examination and measurements are done in the upright position. And to give you an idea, the normal distance in a small breast, small, firm, young woman's breast is about 21 centimeters. And the target is 21 centimeters from the nipples, the sternal notch, which is the very top of the sternum, this U-shaped section of bone right at the top of the sternum, measuring that to the actual nipple itself. Now 26, 27 is not significantly enlarged. Generally speaking, somebody with a double D would have massive breasts, and that distance would be usually in the region of 40 centimeters plus minus. So with the process, already we can see here that her breasts were not very big at all, but we'll show them later.
26 centimeters. So obviously you need a lift as well, hey?
Yeah, definitely. He said make it as tight as possible. That's my Louis' instruction. Leave me flat-chested.
Strange remark, because she clearly wanted some volume after the procedure, but if she wanted to be flat-chested, she shouldn't have had an implant, but we'll deal with that later.
So you want to go smaller, but you also want to have a nice breast mound, and that's basically what we do. We do like a breast lift.
At this point, I was demonstrating the lines of incision on her breast to show her where the incisions would be placed and how the nipple is elevated to the desired height, which is around 21 centimeters. So you can hear me explaining this to her.
And then we remove as much of the breast tissue as we can, say like up to 90%, you know.
Normally, in a normal breast reduction, the surgeon wouldn't remove this much, but in the light of the fact that she said that she was experiencing pain due to the breast tissue, that was the objective, although that is certainly on the high side and doubtful whether it actually was that much.
We can't remove everything, but certainly we can debulk it by a lot and then just put a nice implant in. And then because it needs a lift, we do it through a keyhole pattern like that, and then it goes out like that, and then like that, and then we basically shift the nipple into the keyhole and then close the keyhole down here. So you end up with a scar around the nipple, straight down, and in the fold of the breast here. So it's like that, and then you'd be fuller up here.
I was referring to the section, the upper half of the breast, where that normally lacks fullness in a person or a woman with droopy breasts, and that's normally what they want, is fullness in the upper breast, and that's what I was alluding to.
Then you'd have more fullness up here and bulking of the breast itself.
I'd like to return to my original breast size, which is a B.
Okay.
Definitely.
Yeah.
I need to go and buy my bras now.
Strange remark, because her breasts were certainly not in the gigantic range. As you will see in the photographs that I'll show shortly, she was probably looking at about a large C or a small D.
Yeah. Okay. Yeah. Okie dokie. You can get dressed. That's all I need to see. You are currently what? A D?
Going for an E.
This is a flagrant untruth. There was a reason for her saying that she was wearing a double D or an E bra. There is simply no ways that she was in the DD or E range.
Okay.
The other problem that I've got is that we need to do it like ASAP.
Another strange remark, but as the story unfolds, you'll appreciate the reason that she wanted to do it ASAP, because there was certainly no reason to do it ASAP, apart from the fact that maybe it was over the December period, but there was certainly no urgency to do this operation as a matter of priority.
Where are you moving to?
Well, we sold the house. The problem is to find somewhere else. Don't know where to go.
Yeah.
We thought of a plot. We want to do some property development and cash flow.
This is a very significant remark made in the consultation, cash flow. You will see that she alludes to the issue of cash flow on a number of occasions, and as the story unfolds, you'll see how significant this issue is.
Okay. Are you involved in property at the moment then?
We've got a couple of stands, but the recession has knocked us really hard. Extremely hard.
Now that's significant. Both her and her Louis, as she referred to him, had fallen on hard times, and they were experiencing cash flow problems. Let me just leave it at that for the moment.
Oh yeah, no, absolutely, hey.
Hopefully it'll get better and our cash flow grows.
Well, her cash flow did grow, but not for reasons that you think.
Okay, so while I print out the quote here, I'm going to have to advise you of the risks involved. The material risks with the operation itself.
This was a standard portion of my consultation. I did it with every single patient that I saw. I would never skip this part, and my only regret is that I didn't record every single consultation explaining the risks involved, because if you follow my story, every single complaint at the HPCSA said they were never advised of the risks of the operation. But that's part of the bigger story.
A very high success rate. Probably the biggest cause for concern is your smoking. The reason being is that smoking is deadly to tissues like the nipple, and we need to lift the nipple like that.
The principle here is that the blood supply to the nipple would be brought in through the flap or pedicle of breast tissue with the arteries, veins and nerves. And with smoking can cause the blood vessels to contract down and impair the blood supply to the nipple. Usually only seen in heavy smokers, and at the end of the day, nothing occurred as a result of her carrying on smoking. No complication eventuated, which was not what she wanted. She wanted serious complications.
If we were going to say just the breast implant, it's not too much of an issue, because what happens is when we're shifting the nipple like that, we're maintaining the blood supply, but that can get quite tenuous.
This typically occurs in very large breast reductions, in a genuine DD or E, where that pedicle, that little island or peninsula of tissue, can become kinked, kinked is the best word, and that can cut off the blood supply. In her case, she would have had a very, very stable and robust pedicle or island or peninsula of tissue to bring in blood supply.
Quite tenuous.
At this stage, I was somewhat distracted because I could feel that a call was coming through on my phone, and I just took out my phone to silence it.
Sorry, man, just let me silence that. Sorry. So you need to stop for about 2 weeks beforehand. What I can suggest as well is that I saw a patient the other day who was using that, I don't know if you've heard of it, that electronic cigarette called...
This was when vapes and electronic cigarettes were just starting to come out, and I thought this was a reasonable alternative to smoking. I don't think she had any intention of even trying them, but we'll carry on and we can take it from there.
enjoy. And apparently it's quite good in the sense that it does sort of simulate the effect of a cigarette smoke without the poisonous substances in the actual cigarette itself. Because that's obviously the biggest, although we can treat it and we can reconstruct, or the biggest risk is that you could lose your nipples basically.
I was beating around the bush because it's always a risk with any breast reduction, is that if the pedicle get kinked, the blood supply can be cut off. And of course, if there is smoking, that can aggravate the situation considerably. But it is quite possible, and indeed not often, fortunately not often, to reconstruct the nipple should it be lost in the operation.
So you need to abstain completely. That enjoy is also fine if you want to do that as a substitute for cigarettes leading up to the procedure. So even like one cigarette can be detrimental, and you need to also stop for 2 weeks after it as well.
In other words, to quit.
I'm not quite sure of you need to stop. She didn't understand, but let's carry on.
Like that's the first prize. That's first prize. But just for that period while it's re-establishing the blood supply to the nipple. And then things like the implant itself. I would put it under the muscle because that will give you the firmness and it will hold up nicely. There'll be no weight on the breast. But the big thing with implant is infection. And when we are putting implants in the body, infection is always a risk. Strangely enough, with this particular operation, it's hardly ever a problem. It's normally when you're just putting the implant straight in. But if we should find ourselves in a situation with infection, we need to, if we can't control it with an antibiotic, we need to take out the implant, wait for 6 months and then reinsert it. But it's extremely rare anyway. But it's even more rare with this particular operation because it's a nice procedure.
Yes.
The same with bleeding. Bleeding can occur now and again. Most of the time it's not an issue, but again, sometimes we require, we need to take you back to theatre just to clean out everything and stop the bleeding and all the rest of it. I've actually forgotten to add an item on your, I just want to print out another quote, because what we've got a little, unless you don't want it, we've got a little insurance policy which costs 600 Rand as a premium.
So in this situation, I was making available to her a safety net that in the event of a complication such as bleeding and a blood clot, which required a trip to theatre, she wouldn't incur the further financial burden because this procedure wasn't covered by the medical aid. And normally, if it was covered by medical aid, they will cover the cost of any complications, any trips to theatre that might be required. So her financial risk was lowered significantly, almost eliminated. But as you'll see, she had another agenda.
And will cover you for any theatre, any complications that will occur within the first month as a result of, say, any trip to theatre and all the rest of it. So I think it's quite worthwhile for that little cost. I'll just add it in here.
The quote, does it include hospital stay and...
Yeah. As I say, I'm quite happy to do it here because it's not massive. If it was like massive reduction, I'd say, you'd be saving a good 10 grand by doing it here as opposed to doing it in a hospital.
So here, there's a very clear allusion to the fact that hers wasn't a massive breast reduction. It wasn't in the league of a double D or an E cup sized breast, which needed to be reduced. And the tendency in the last few years, in fact the last 10, 15 years, is to do breast reductions on an outpatient basis. And there are many, many studies substantiating this theory and practice. But as you see, she'll make a meal of this later on in her testimony on a documentary TV program which was aired in 2021. So she could have at this stage said, "Doctor, I want to do this in the hospital. I want to pay another 20, 30 grand for peace of mind." But you'll see what she says.
Setting.
And that means that I go home on the same day?
Yeah.
Oh, wonderful. We're just around the corner, basically.
So it was wonderful then when I saved her a good 10, 15,000 rand in those days. This was 12, 13 years ago. But it then becomes a problem when she's relating her testimony on national TV.
It's just printing out. Okay, I'm just going to, so that's basically it. And then obviously things like scarring, most of the time people scar pretty well.
As you see, I go into quite a lot of detail regarding the possibility of scarring, because scarring occurs with every single operation, and scarring takes a long time to settle down, usually in the region of a year to 18 months before the scars are soft and mature. The scarring is at its absolute worst around 6 to 8 weeks, and it's only after 6 to 8 weeks that it starts to soften. But as you'll see, I mention that I had a few maneuvers to minimize or lessen the chances of scarring. But again, she makes a meal of this at a later stage.
Sometimes you get people where they kind of would develop what's called keloid scarring or thickened scarring. I've got a couple of tricks that I'll minimize the chance of scarring. There's a small chance, about 4 or 5%, develop sort of thickened scars that would actually require another surgical procedure or some form of revisions or injections.
The injections we're talking about here are a solution of steroid into the scar itself, which actually shrinks the scar somewhat. But keloid scarring is a difficult problem, and it does help, but they are a very difficult problem to sort out.
Or whatever, but it's very much the minority. Normally within a year, 18 months or so, that the scarring has settled down, and then the feeling in your nipples can be affected, either increased or diminished, and in about 90% of cases it'll come back to normal completely. Most of the time it's actually unaffected, it's normal. So yeah, that's basically the story. And is that what you're looking at quote-wise? And
You're removing most of the breast tissue?
Yes, yeah, I've said breast reduction. It's just how it comes out on the thing, but basically the sort of technical term would be a subcutaneous mastectomy, but it's basically to debulk the breast and then leave you with an implant. So in other words, I take out hugely more than I would normally for a breast reduction, because normally we leave enough left over to make a nice breast mound. But I'd be taking out more breast tissue than normal in your case.
So this just explains that there's normally adequate remaining breast tissue, which is fashioned out of the peninsula of breast tissue to create a nice breast mound and to lift the nipple up to the desired height or aesthetically pleasing height. But because I was doing a more radical procedure, I was inserting an implant. It gets interesting later when she goes to see her expert witness, Dr. Leslie Berkowitz, and then the HPCSA's so-called expert witness, Professor Gijsie Annandale. But all in due course, we'll get to that later.
And You say that I can only do it in 2 weeks' time?
Well, as I say, we could say make it like, I don't even know, like the earliest would be next Thursday.
So this next Thursday was 10 days hence. And I was explicit in saying that it would be the earliest would be next Thursday. You'll see what she did next was incredibly devious because she wanted things to go wrong. She wanted the operation to go wrong. And it didn't happen. The operation was a spectacular success.
Oh, excellent.
Yeah. Just ask Brandon in the front there.
Like I said, I don't want to exactly do a move. And what's the recovery time?
We're looking at about a week, eh?
A week? A week?
Yep.
This is a week is normally the sort of most stormy period in terms of pain and discomfort. Obviously, the scars take a good 6 weeks to sort of seal, and it takes many, many months for the scars to settle down and become mature and fine. But normally it's actually the first 2 or 3 days that's pretty painful. But yeah, about a week is what we're looking at, week, 10 days.
Oh, a week or 10 days or so. It's really just for that initial stage when the pain, once you're comfortable with the pain and all that.
And I can carry on as normal?
Yeah.
Because I've got to pack and everything. I will come in next.
So she reiterates her undertaking to come in 10 days from the time of the consultation. Okay. She said she would come in the next Thursday. She then alleges that I agreed to do her on the Thursday following our consultation, so which was basically 2 days' time. And this is something that her attorney and expert witness milk in the extreme.
Next Thursday. And in the meantime, I will go buy that stupid electronic thing and get off.
She had no intention of getting that stupid electronic thing, nor to get off her cigarettes. But that's just by the by.
My cigarettes.
Okay, good stuff.
So you are actually doing him a favor. He might come in. Thank you very much.
Okay, so that is the consultation I had with her, and I'm sure you'll agree that in anybody's book this would be regarded as a reasonable and adequate sharing of information and a comprehensive explanation of exactly how the operation was done and what to expect after the operation. In other words, I gave her a reasonable timeline of what she could expect with the recovery and scarring, and that indeed it would take about 6 months to a year for the scars and swelling to settle down. And I also explained that there would be considerable swelling in the initial months after the operation, and it also takes approximately 1 year for the swelling of the breast to subside, which is representative of the final result of the operation. In the next portion of the video, I will discuss at length the documentation associated with the operation. I'll first go through the quotation which I gave her, and you will see that it is patently obvious that there is a line item devoted to the insertion of breast implants and a fee for the implants, which she paid for. Later in the video, actually the next video, you will see that Dr. Leslie Berkowitz, in his so-called expert witness report, will allege that I had cocked up the operation, and in an attempt to cover up my blunder, I had inserted implants and tried to cover it up. I'll then briefly discuss the rationale for doing a breast reduction in a day clinic, because ultimately there was a lot of criticism against me for doing the operation as I did it in a day clinic setting, but there is strong evidence to support this practice. Next, we'll go in considerable detail regarding the consent which she signed, and as you will see, the risks and complications are very well laid out, and she initialed each paragraph to show that she had read it and was in agreement with the consent. After I've discussed the consent, I'll go into some detail to have a look at her pre-operative photographs. As you will remember from the consultation, she goes as far as to mention that she wears an E-cup bra, and this should have been a warning sign to me because it indicated that she was up to no good. As you will see from her actual bra cup size, she was probably no bigger than a very small D or a large C cup. An E cup bra is one full cup size larger than a double D bra, and a double D bra has to accommodate massive breasts, which Naomi Gomes didn't have. Next, I'll go through the post-operative notes that I made for every post-operative visit that I saw her, and you will see that there was nothing untoward that happened in her post-operative period. She had a smooth, uncomplicated post-operative course. And when I saw her on the last visit on the 19th of January of the following year, she looked me in the face and said that she was happy with her operation.
This is the quote that I had given Naomi Gomes on the day of her first consultation, which, as you see here, is the 1st of December 2009. And as you can see, every line item is clearly laid out. There is a fee for the operation, which in today's terms would be absolutely nothing. The assistant, which is the guy that helps me during the procedure to make it go faster, an anaesthetist fee, the clinic, which is also pittance in today's terms. And then very clearly here, you can see there's a quote for implants. If you'll recall the consultation that I had with her, the use of implants was very clearly discussed with her. And you will see that there was an insurance, as I mentioned previously in the consultation, an insurance policy that would have covered her for any eventualities which would have necessitated her going to theatre. So there was the financial risk was very, very, very much lowered and almost excluded completely. And as you will see later in a report by her expert witness, Dr. Leslie Berkowitz, he comes to a rather startling conclusion that I had botched the operation and taken out too much breast tissue in order to cover up my mistake. The breast implants were inserted, well, he alleges that I inserted the breast implants without her knowledge and consent. So let's just digress briefly about the concept of day case surgery, because as you will see later in her testimony on the TV program for May, she makes an issue about the fact that the operation was performed in a day case theatre, and there's overwhelming evidence in the literature that doing breast reduction in a day case is in fact completely safe and has many benefits. As you can see from the abstract, it says the feasibility of performing breast reduction surgery on an ambulatory basis was evaluated in a prospective study. Of the 64 patients presenting for breast reduction surgery, 50 were selected as suitable for day surgery, 78%. Of these, all were able to be discharged on the day of the surgery. The study has shown that it is safe and appropriate to perform breast reduction on an ambulatory basis. Patient recovery is rapid, and the complication is equivalent to that of other types of surgery. So we'll return to this issue later on when we deal with her testimony. Okay, now let's look at the general consent for surgery, and I'm going to take you through some of the salient features of the consent form, because as you will see later, the plastic surgeon that she went to visit made some patently false and remarkably inaccurate factual conclusions. As you can see, the consent starts with I, Naomi Gomes, in my capacity as a patient, do hereby give my consent for the performance of this procedure. And there it is written, bilateral breast reduction plus implants, followed by my name. So we go back, sorry. So now we're just going to go through some of the features of the actual consent form. In this slide, you can see that there are other comprehensive terms and conditions of the consent, and all patients were required to initial each paragraph to ensure that they had read through the contents of the consent. Now, I won't go through every single clause of the consent, but of significance, in the first paragraph, where it says, I am satisfied that the surgical procedure, as well as the anesthetic procedure, have been fully explained to me, that my concerns have been addressed, and that my questions have been answered to my satisfaction, leaving me in a satisfactory position to weigh up the risks and understand the limitations of the procedure. Significant potential complications of both the surgery and the anesthetic have been explained to me, and I've had the opportunity to discuss the alternative modalities. As you have heard from the consultation that I had with her, I had mentioned the most common complications encountered. And the next clause of relevance is the number which says, I acknowledge that I've had the opportunity to discuss the cost of hospitalization as well as additional expenses which may arise should complications occur. I further acknowledge that I remain responsible for the payment of all hospital expenses, irrespective of any contract that may exist between myself and any third party such as my medical aid. You will also recall that there was a small policy which she took out for which she was covered in the event of any complication occurring. And indeed, this is a very elegant safety net for her, should she have suffered a complication. As you will see, she had an alternative agenda. The next point is also significant, where it says that I understand that no guaranteed can be issued for the uneventful cost of the procedure or subsequent surgery, but that the surgeon, anaesthetist, and nursing staff will take the necessary steps to reduce the likelihood of those complications from occurring. Apart from those clauses, it's pretty much a standard consent form. Now we'll look at her signature. As you can see, in this portion of the consent, her signature is placed here next to the X. The witness was a nurse in our clinic by the name of Sandy Pillay, and it was signed on the 3rd of December 2009 at 6:58 a.m. So let's go and have a look at her pre-op photographs. So, as I mentioned previously, she mentioned that she was a double D or an E. And this will give you an idea that this was certainly in no ways a double D or an E. And let's just put them all side to side. And as you can see, her breasts were certainly not massive by any means. And as we go forward, I'll give you a lot of information, and we'll deal with her story as she told it to her attorney, as well as the expert witness, plastic surgeon Dr. Leslie Berkowitz. In pic 1, if we look at the front picture of her immediately before the operation, in my career spanning the better part of 22 years, before I was suspended from practicing, I've seen literally thousands of breasts, both big and small. And you will notice in her consultation that she said she had a C cup, which is absolutely diabolically false. And I suspect that it was part of her conniving scheme, as you will see as the story unfolds. In the second pic is a three-quarter view of her breasts, and I'm sure you'll agree that she had beautiful, natural-looking breasts. And indeed, many of the patients I treated were seeking breast enlargement and would have killed to have breasts like these. They had a beautiful shape and are certainly not unattractive. As you will see later, when she visits Mr. Gary Austin, who issued a summons before she had even seen the expert witness acting for her, she reports her breasts to Austin as having a double D cup. Now I can say with 100% certainty that the breasts that you see in this picture were not a DD. Her bra size at this stage was at worst a small D or a big C, but as you can see from the story, as you see as the story unfolds, she had nefarious intentions at this stage. In the third pic, which is a side-on view of her breasts, I'm sure you'll agree that there's nothing unattractive about her breasts, and the only reason here to perform a subcutaneous mastectomy and implants would have been for the reason that she stated in her consultation, and that apparently, and I stress apparently, had painful fibrocystic disease. The other possible reason would have been if she had a high risk for breast cancer, in which there would have been 100% certainty of developing some form of breast cancer on a genetic basis. You probably remember that Angelina Jolie had a mastectomy and breast reduction because she possessed this gene. As you'll see later in the video, she tells Gary Austin and Dr. Leslie Berkowitz that she still has double D breasts. I'll show you that it is physically and mathematically impossible to take out 400 grams on each side, which is nearly half a kilogram on each side, and place a small implant under the muscles and still be left in inverted commas with enormous breasts. I'm sure by now you're starting to suspect that there's something very fishy about Naomi Gomes' story. As you will see throughout the story, she's an unabashed, barefaced, and untrustworthy liar. Now let's have a look at the operation notes. Now, these are the notes that I made after the operation. I stated that the operation was carried out without any significant events, and as I stated, she had a breast reduction with implants, and as I said, I removed approximately 450 grams from each breast and then placed 200 cc implants on each side, 280 cc, which is very small. If you can imagine a cup, standard cup is 240 mils or cc's, and so it was just slightly larger than a cup of coffee, which is a very small implant. And because she had a substantial reduction and she wanted as much breast tissue removed, and it was my intention to restore the volume with small implants. Now, by virtue of simple mathematics, her breasts must have been smaller after the operation. And as you will see, she complained later that she had a double D breast, which is very hard to accept because with the settling and the swelling which would have occurred over a period of a few months, it would have settled down beautifully. So let's look at the day one post-op. So I saw her on the 4th of December 2009, and this involved usually seeing the patient, inquiring how they felt, how are you feeling today, and if she had any complaints, and whether there were any suspicious signs like bleeding or blood clot or anything that was out of the ordinary. But in her case, the dressings were in place and there was nothing to be suspicious about or that warranted any form of supplementary surgery. So what I did was on the 4th of December, I made a note that all was well and the drains were removed, and then that was the last I saw of her. It would have been a week later. Now, it's important to mention that December is usually a hectic time of the year for me because many people at that time would be off over December, the holidays, and they'd also have received their bonuses. So they wanted to have their surgery done. And I made it a policy not to go away in December. Because if I was away in December and complications occurred, it was a huge hassle to arrange a locum or to arrange one of my colleagues to see the patient. So I would just not go away. I would rather go away in January when the practice was quiet. The patients were also told by my assistant and the staff members that the fee for the operation includes any post-operative visits up to 4 months after the procedure. They were told that there were no further costs should they feel the need to see me. And indeed, on many occasions, I would say to a patient, if they wanted to see me every day, they could, if they were concerned. So Naomi Gomes would have been aware of the fact that she could have got a hold of me at any times, should there be any complications. So she would have been seen a week after the operation just to snip off the sutures and be given the instructions on taping the wound and applying a scar repair cream on top of the wound, and the wound would have been dry. So now we go forward to day 47 post-op. Now, the next time I saw her was on the 19th of January 2010, which was 6 weeks. This was a 6-week follow-up visit. I'll take you through the clinical notes that I made on my computer, and strangely enough, of the thousands of patients that I have seen, I do remember seeing her because in the light of what unfolded subsequently, my memory of the follow-up was reinforced because I was utterly dumbfounded by what transpired. So in my notes, I noted that she had a small raw spot, probably about half the size of a fingernail, a small fingernail, a small raw spot at the right T-junction. Now, the T-junction is the area where the vertical wound running from the nipple down to the horizontal wound. And it's not unusual here for there to be a bit of breakdown at this point, and 99% of the time it will heal up without any problems. I also noted a slight, small wound on the left vertical limb, and that is the wound running from the bottom of the nipple to the horizontal wound. And apart from that, every single wound was healed completely, and there was no sign of any infection. And I distinctly remember asking her whether she was happy with the result, and she smiled at me and she indicated that she was happy. I also pointed out to her, I made it specifically clear that her breasts were still fairly swollen, just a standard reassurance that you give in the post-operative period, and that would settle down in due course. Because this is a very common question from patients after any form of breast surgery, and I'd always advise them that it takes anywhere from between a year to 18 months for the swelling of the breast to subside. And in my notes, I specifically noted that she was welcome to contact me should there be any problems. So she never mentioned a single word of any form of dissatisfaction, that she was unhappy with the operation, or that the operation had been a disaster. I never heard from her again. Now, in instances like these where they have an uneventful post-operative course, I tell them they can come and see me in 6 months. And this is usually the thing, is to see them at 6 months. But they are welcome to see me any time of the day. And from time to time, I would have the odd patient who would come back after 2 or 3 months saying that their breasts were still swollen, and I would simply reassure them. And then when they came back to see me on their annual checkup, they'd be completely happy.
Okay, so it's self-evident that she had an uncomplicated post-operative course, and she never breathed a word about any unhappiness that she had with her treatment or discomfort regarding the taping of the scars. As you will see as the story moves forward, she went on to fabricate the most nefarious set of lies, collaborating with Gary Austin. And I'm going to wrap it up now for part 1 of the Naomi Gomes scam. In part 2, I will deal with how she sued me. Yep, believe it or not. I will dive into the summons that was served on me and drafted by Gary Austin, and you will see that it is just a litany of lies. I'll also go through in detail the so-called medico-legal report of Dr. Leslie Berkowitz, which, if it wasn't so sinister, it would be hilariously funny. As usual, please like this video if you enjoyed it, and subscribe to my channel to help it grow, and I would really appreciate that. Remember, if you'd like to read my first book, click on the link in the description, and I'll see you in part 2.